So diabetes is a systemic disease that affects the blood vessels in our body. The ones that it affects the most is the kidneys and the eye. So that's why you can get early signs of it. So our family doctors or endocrinologists usually send patients here to see if there's any early signs of diabetes in the patients. So this is a machine that will help detect early signs. And this machine has the capability of seeing if there's any fluid in the macula, which is found with patients with diabetes. So I'm going to show you an example of a patient where early diabetic changes have started to occur. The macula is our central vision. So as you can see here, it's nice and bent. This is all straight. So this is what a macula is supposed to look like, okay? However, sometimes that macula can have fluid which affects a person with diabetes. So I'm going to show you an example when there's fluid in the eye due to diabetes, okay? And so here's an example of a patient that has that fluid, as you can see. It's elevated. Now this person may have some visual changes, but most of the time when people have this fluid in here, if this certain area is not affected, their vision is 20/20 and they won't even know it, okay? So that's why this machine helps detect any fluid that's underneath that I can't really see or appreciate when I'm in my room because I'm looking at it like this. Unless it's really elevated, then I can see. So this helps detect early signs. The other feature that this does in terms of angiography is that it helps detect if there's any blood vessel damage. So normally when blood vessels get damaged, they leak fluid, and that's how you get this. So I'm going to show you what this does in terms of detecting early signs of diabetes. So like I showed to you earlier, this is a normal macula, okay? It's nice and normal. There's no elevation or anything, but I'm going to show you the capability that this does by looking at the blood vessels. So when I look at this feature here, which is angiography, you can see that there's all these blood vessels, but there's the start of regression, how it's, instead of like a circle here, it's starting to get enlarged. So we call this the foveal avascular zone. And so what they're saying is that people with diabetic retinopathy, before it starts, this avascular zone will start to get damaged and get bigger and bigger. So we can actually now detect things earlier by looking at this area, okay? So this looks at the blood vessels on how big the foveal avascular zone is and how much blood vessels are getting damaged.